kids, roughly 50% today, experience decay. And we kind of put that down to bacteria being on the surface of the teeth, and that, you know, we're not brushing it off properly, and that there's this plaque building up, it's eating away at the minerals of the teeth. But that's not the full picture. It doesn't consider what's happening inside the teeth. And there is actually a whole system, an osteoimmune system, that is basically designed to provide an immune response to anything that's happening in the mouth. Now, if you have bacterial imbalances, yes, if it happens long enough, you may get a response by those certain bacteria. But the key factor is that, does your body have the requisite nutrients to support the osteoimmune system? That's vitamin D.
If you haven't done so already, go ahead and click that subscribe button down below. It's a little red button. You punch that, and it's going to notify you every time we put out a new episode that can help you improve your bone health. And then also, if you haven't done so already, head over to BoneCoach.com, sign up for the free 7-day Osteoporosis Kickstart. That's going to walk you through everything you need to be doing right now to get on the path to improvement and stronger bones. After you do those two things, go ahead and press play on this episode, and I'll see you inside. Welcome to this episode of the BoneCoach Show. Joining us today to explore building strong bones and teeth, functional dentistry, and the dental diet is Dr. Stephen Lin. Dr. Stephen Lin is a board-accredited dentist, TEDx speaker, and international #1 Amazon best-selling author. As a passionate health educator, Dr. Lin is forging the path for functional dentistry to prevent the future generation from experiencing dental disease. His work has been featured on television, print, and radio to millions of people worldwide. His professional training courses are educating a new wave of healthcare providers to apply functional dentistry to help you achieve whole body health. Dr. Stephen Lin, it's a pleasure to have you here today.
Hey, Kevin, thanks so much for having me. It's a pleasure to meet you.
This is such an important topic, and we were talking about this right before we came on here, how there's such a big connection between oral health and osteoporosis, and we're going to get into that. But I'd like to start with introducing people to not just you, but also what functional dentistry is. So can we talk about what is functional dentistry and how is it different from traditional dentistry?
Sure. It started a few years ago when I was practicing dentistry, and I found that the skills that I acquired in my degree wasn't really serving my patients in a way that I felt that was useful, or really kind of understanding what's happening with their conditions. A good example is gum disease. One of the most common conditions in the world, which is just inflammation of the gums. But what we're taught in school is just to scrub it clean and to teach the patient to be absolutely meticulous with cleaning, which works to an extent, but then kind of in school as well, they say that, hey, it doesn't work a lot of the time either. So there are a few alarm bells kind of ringing that, the tools that I had wasn't quite adequate to really serve, the needs of my patients. And I took some time off dentistry for a time there to kind of reevaluate if I could really do this for the rest of my career. When traveling, and I actually came across a book called Nutrition and Physical Degeneration by Weston A. Price, and that he was a dentist that lived in the 30s, and he went around the world and actually documented how when humans come off their ancestral diet and start to eat the modern diet. So in the 30s, he was actually showing this kind of exact point in time. And then he was showing that dental disease popped up as soon as we ate the modern diet. And he saw the same patterns in his home in Cleveland, Ohio with his patients. And he was building a hypothesis that food was the basis of all of the conditions we see in the mouth. And that's both tooth decay and crooked teeth as well, which was a big kind of eye-opener for me, the development of the jaw being connected to food, and it's what we eat and our nutrients as being a driver for the development of both the jaw, but also how the dental arch forms too. And so then that kind of pushed me into the world of trying to understand what was actually going on in the mouth. And then and that's where I wrote my book, The Dental Diet, which was the scientific basis of what Price found, but then also to the modern food principles we do to eat for strong bones and teeth. But then it kind of led more into a clinical model, which we've been doing for the last 6 years or so in the practice, trying to connect oral health to systemic health. It's one that we've actually known has a very significant connection to our systemic health through the connection of heart attacks, metabolic diseases, and now even Alzheimer's dementia. Through they detect gum disease bacteria in the brain, and they detect that as being a driver for Alzheimer's dementia. Yet we just don't really connect this in society. We don't see the mouth as being a key piece in our health picture, but also too, we're not really told how to actually improve our health. And one big factor is that, the hard tissues, the teeth, and then also the bones. This is something that I'm seeing in patients daily now that are dramatically affected by how we eat and how we sleep and how we breathe. And that there is this amazing picture that actually comes together if we consider the mouth as well. So that's kind of what functional dentistry is. It's trying to understand the root causes between dental disease and connect it to systemic issues. And skeletal issues like osteoporosis is one in particular that I find is just so disconnected because we don't think about the inputs that come through the mouth.
So for those of us who have thought for so long that just going to the dentist, getting a filling, or getting your teeth cleaned, going about your way, that's just the way taking care of oral health is supposed to be, it's time to rethink that. Basically, there's so much more that's connected to it, and that includes diet, nutrition as a big piece of that. And I know you wrote the book, you touched on it briefly, The Dental Diet. Could you talk about what are the core principles of this book that you put together?
Yeah, so in Nutrition and Physical Degeneration, Price talks about fat-soluble vitamins as being the core driver for both immunity to tooth decay. And so this is something we experience more in earlier life, but a bit in adulthood as well. But in kids, roughly 50% today experience decay. And we kind of put that down to bacteria being on the surface of the teeth, and that, we're not brushing it off properly, and that there's this plaque building up, it's eating away at the minerals of the teeth. But that's not the full picture. It doesn't consider what's happening inside the teeth. And there is actually a whole system, an osteoimmune system, that is basically designed to provide an immune response to anything that's happening in the mouth. Now, if you have bacterial imbalances, yes, if it happens long enough, you may get a response by those certain bacteria. But the key factor is that, does your body have the requisite nutrients to support the osteoimmune system? That's vitamin D. And so Price found this. So in every human culture that he went to, 12 cultures around the world, he found that there were diets that were 20 times richer in fat-soluble vitamins. That's vitamin D and vitamin A. And he also identified a third nutrient that he never identified in the book, and he wrote it down as activator X. But vitamin D, we know, is the critical nutrient to absorb calcium in the body. So when we're vitamin D deficient, you only absorb 30% of the calcium out of your diet. It literally just falls out of you. And then vitamin A is the nutrient that actually turns bone over. It actually gets osteoclasts and osteoblasts to work. So our bone cells need vitamin A to work. And vitamin A and vitamin D have a very important synergy in the body. Vitamin D connected to the serotonin build in the body. Vitamin A is what our body uses to make eye cells, so retinal cells that detect light, and they meet in the brain in order to create a neurohormonal balance between light, night, and day, and then ultimately to place minerals into teeth and bones. So this is what Price is talking about. He's showing that, hey, we need fat-soluble vitamins, and this is in foods that are rich in animal products like organ meats, broths. And this is what he showed that humans, and if you look into any ancestral diet, that you find organ meats, you find rich animal foods, eggs, well-sourced dairy. And the reason being is that these foods are rich in fat-soluble vitamins. So he was basically showing that the human diet needs this supply of fat-soluble vitamins, or the dental organ starts to deteriorate. And what he found that also too is, in these populations, they did not have any other chronic diseases. They didn't have things like kind of digestive issues. They didn't have autoimmune issues. They didn't have skeletal issues. These people that were eating these diets had strong skeletal systems. They didn't have chronic disease. They lived to healthy old ages. because they ate this diet that replenished them with fat-soluble vitamins. So the idea that we've been kind of taking fat out of the diet seems to have had a negative effect on our teeth, which is both in tooth decay, but also in crooked teeth as well. In one generation, you start to see the dental arches deteriorate. You start to see crooked teeth appear. And that appears to be due to the lack of fat-soluble vitamins, the connection to testosterone, jaw growth, and then there's a whole host of breathing issues that occur once the jaw starts to deteriorate. So the fact that we do not eat these foods anymore and we've been removing fats seems to have been quite detrimental to our both our dental and skeletal health. And the last nutrient, vitamin, which was called Activator X, it took 70 years, but it took Japanese research and Eastern European research to actually connect the dots between vitamin D and a nutrient called vitamin K2. And K2 is found in a set of organ meats, egg yolks, hard cheeses, and so forth. And the bacterial form is also found in ferments like sauerkraut and Japanese natto. But the Japanese research shows that when you pair vitamin D and vitamin K2, the body absorbs calcium much more efficiently. And actually, when you take D without K2, there is an inefficient absorption of calcium. And that's what Price found without knowing what the K2 was. It's a very funny molecule. It's been hidden in scientific literature across different countries and so forth. We've got no recommendations currently for vitamin K2 dietarily, but it has the mechanism to both strengthen your teeth. And one of the mechanisms actually is to take the calcium out of your soft tissues, which is really important because one of the bigger problems we have now, besides the demineralization of teeth and bones, is that actually our soft tissues are calcifying. We find it in the heart tissues, you find it in the kidneys and so forth. You get stones and things like this. This is a calcification issue. You also find it on the teeth. So you find calculus on the teeth. So that's the same process. So in your saliva, we have these proteins that are vitamin K2 dependent. And what that does is it actually picks up the calcium and puts it into the bones and teeth. When you're deficient in K2, this is probably the first sign that your calcium is not placing the way it should. So that comes from organ meats, broths, and high quality dairy, egg yolks, all of these foods we've taken out of our diet that help to mineralize bones and teeth.
Hey, it's Bone Coach Kevin Ellis. I want to take one more minute to talk about if you are somebody who was newly diagnosed with osteopenia or osteoporosis, and you're at a point where you're stressed, you're worried, you're overwhelmed, you have no idea where to start or how to get started getting confident in your plan. I want to tell you about the Stronger Bone Solution Program. Over 5,000 people have come through the Stronger Bone Solution Program, and it walks you through the exact process you need to fill in the missing pieces, uncover critical things in your plan that you may not be aware of, and help you make modifications, adjustments, and tweaks to get you to the place where you're building stronger bones. I want you to get confident in your plan so that you can focus on living life and enjoying the life that you deserve with the people you love most. So if that's where you want to be, head over to bonecoach.com/apply and apply for our Stronger Bone Solution Program right now. I'm Bone Coach Kevin Ellis. I want to see you inside this program. I want to help you get on the path to improvement and stronger bones. Hope to see you inside very soon. Let's get back to the episode. And that's one big piece of misguided nutritional information that people had been seeded and recommended for so long. Remove the fats, go on low fat diets. Are there other misguided dietary recommendations that you see out there that you feel are a big threat to people's dental health, oral health, and even systemic health?
Well, you've got the harmful things. So, when you look at the modern diet, you can kind of boil it down to kind of your simple sugars, your grains, and vegetable oils. And so those foods that are still recommended, to be consumed daily. I think these, like, I'm not a zealot against these kind of foods, but so for instance, I definitely recommend cutting down sugar, to almost zero. Vegetable oils should be cut down to zero. And the reason being is that vegetable oils don't provide a good platform to absorb fat-soluble vitamins. Your body has to absorb in your digestive tract, and then basically your blood cholesterols are designed to carry your fat soluble vitamins, your D, A, K2, and the other important nutrients around the body from the liver. And when you have vegetable oils, which is your kind of canola oils, your sunflower oils, your polyunsaturates, then your blood cholesterols aren't in the format that they should be. We should be 50% saturated fat. When you cook with vegetable oils, or when you have food with vegetable oils, it seems to create dysmorphia with these blood cholesterols and the body's ability to absorb fat soluble vitamins. And remembering the body uses this fat to absorb into bones. So for these nutrients to go into your bones, you need to have the natural balance that they come in your nature, which is in the animal form. So 50% saturated fat, lots of saturated fat. And replacing vegetable oils in the diet has been detrimental, in my opinion, for that reason, because it takes our ability away to absorb these nutrients effectively. So if you have a vitamin D supplement, for instance, and you're having vegetable oils, I would say that it's likely you're not going to absorb it very efficiently. Sugars, and then you got your grains like your cereals. So like your refined flour has been shown to behave very similarly to sugar as well in the body. So basically, when you have like a cereal or a baked good or something like that flour breaks down to basically sugar, which performs similarly for tooth decay on your teeth. But then metabolically as well, it's going to spike insulin, and you're going to be in poor metabolic state. Where if we think about for your teeth and bones, your body needs to be highly optimized and highly nourished in order to have enough nutrients to place minerals into your bones and teeth. So I would be thinking that you want to take out these more harmful elements and then be replacing with more nutrient dense versions and so forth.
Yeah, and one easy adjustment. I know so many people have focused on the sweet and sugary starts to the day, whether it's like some kind of sweet breakfast, a pastry, or some kind of cereal. If you can just swap that to a more savory version, for breakfast this morning, I had some grass-fed bison with some organ meats kind of ground up into it, and some healthy greens with some arugula and asparagus and all that. And most people would hear that and they'll be like, well, that's a meal for dinner. If you can reframe your thinking around that, you can really start to get some high quality nutrients earlier on in the day, which is so, so important. Let's talk about, can we discuss the connection between oral health and overall systemic health? So I know you touched on some of the nutrients specifically, but maybe the connection between oral health and systemic health, particularly for women 50 plus.
Yeah, sure. It's one that we see very often in the clinic where especially in the age group where we're starting to maybe to move into the period of perimenopause or menopause, and where there's hormonal shifts. What we start to see is that in the literature we see a link in particular between gum disease and heart issues. So heart attacks. So we see an increase of risk of heart attack in people with gum disease. And so gum disease is one of these ones that we mentioned earlier that we're told that we have to clean religiously, scrub which is true. Like you should be seeing your therapist every 6 months, because as we get older, you start to get higher risk areas in the mouth and so forth that you want to have clean, but you want to be thinking about what your body is telling you. When the big thing that I think we've missed with, in particular, gum disease and this risk that as we get older, that our gums and bone just kind of erode away, is that this is an autoimmune issue. And so gum disease has been shown in the literature to be linked to all of the different autoimmune conditions like rheumatoid arthritis, through things like lupus and even MS. And what we now know is that autoimmunity is something that seeds in the gut. So when you have permeability in the gut, the immune system will actually seed immune signals through, because of the gut barrier not being sufficiently, basically a good enough barrier. Same things happens in the gums. So your gums are actually the start of the gut. So the oral microbiome and the gut microbiome are a communicative population. So when we have gut issues, we have oral issues, and vice versa. And that is actually, so when you have gum disease, it's an expression of autoimmunity, which ultimately is deficiency. But we should be thinking about how we improve this barrier system, which is in the gums, because your gums absorb things as well. You start absorbing nutrients. There's even literature that shows that teeth themselves absorb specific nutrients. They show that in rats. That's an interesting area. But your gums as well. So they show that certain absorbents will go straight to the heart, for instance, from the mouth and so forth. And so we should be thinking of it like this, in this connection between the literature, between blood pressure, heart attacks, and then also to the big one more recently is Alzheimer's dementia, is that anything that's happening here is going to be communicating around the body. And I wouldn't take that lightly. I'd be thinking that, we want to have a really good picture on this. So if you have any kind of bleeding gums or inflamed gums, that's a sign of inflammation. It's a sign that your immune system isn't happy with what's going on. Yes, we should be thinking about cleaning and seeing our professional and so forth, but we want to more be thinking about the system. I'd be thinking about nutrient deficiencies. And the other big factor of that is breathing, how we're breathing at night, because what happens is that when we're breathing incorrectly, the oral environment changes, and you can create a susceptibility to these kind of things. So gum disease, which is a big risk in these age groups, whilst we should be using and trying to use our dental tools as much as possible to keep it under control, we really need to be making an approach to balance the system moving forward. And with autoimmune issues, it's your vitamin D levels. It's restoring those nutrients that underlie that gut barrier, but also the barrier in your gums as well.
You mentioned you're seeing it in maybe a rise, or at least the prevalence of osteoporosis in people that are coming in to see you that have issues with maybe their gums or oral health. Can you talk about that gum disease osteoporosis connection a little bit more?
Yeah, as dentists, we actually see this quite a bit. I had a guy in that's 52 yesterday, and he's being diagnosed with osteoporosis, and they're trying to put him on the drugs that stop the metabolism for the bone. And this is a big the big issue for dental, because once you get on the bisphosphonates, then you've got a whole host of risks for any kind of dental issue that you have. So it's a big thing, because you can have a serious dental infection once you get on these osteoporosis drugs. So we actually we have a rising amount of questions, and the doctors will actually send them to us, which is really good. And I try to dig into why it's happening. And this guy's 52, he's healthy. He's had a bit of family trauma and everything, but he's shown these bone densities going down. And so what what I asked him is that, so what are your vitamin D levels? What are the doctors doing with this? And there's no acknowledgement of the role of vitamin D in the lack of bone density. And it's just crazy that the first step, so he was actually coming to me for the approval to go on bisphosphonate drugs, and they hadn't even looked at an approach to manage his vitamin D levels. And this is across the board. There seems to be this kind of lack of, or just the medicated approach where we're going to bisphosphonates as a first line, but vitamin D, osteoporosis is vitamin D deficiency. That's what it is, right? So it's like, starting to think about how do we support this. And so one is getting those levels, and I really think if you're if you've been shown to have lower bone density, we should be getting our levels up to close, 60 to 80 nanomoles per, it's milliliters.
The NGML, 60 to 80.
Yeah, NGML, yeah. We work in the nanomoles, which is a bit higher, 200 to 250. But 60 to 80, I think would be a better range. But then you also want to be thinking about support nutrients. So you need to be taking D with K2. I do think people taking D should take vitamin A as well. And I do think they should be taking coenzyme Q10. One good one that we've found that works with patients as well are beef organs. Desiccated beef organs works really well alongside the supplementation. And then, using a protocol like this for say 3 to 6 months, maybe retesting in 12 months their bone density before going onto those regimes, with your dietary change. And we also start to look at the sleep as well, which we'll talk about in a little bit, which is really important. But so having an approach at getting your collective vitamin D levels up, I think, one for dental health, when I'm looking at a patient, you always want that optimized because their dental health is going to be markedly better when these levels are managed. But if they're at the stage where you have lower bone density, like this is where we need to be thinking. So, okay, so an approach here that is going to create long-term mineralization in both the teeth and the skeletal system. And they're unfortunately just not getting that from their health professional, from what I've seen.
Yeah, and what I've seen is the standard recommendation for most people that get told, hey, you've got osteoporosis is take some calcium, take some vitamin D, go for a walk. Here's your bone drug. We'll see you in 2 years for your next bone density scan, right? And it's woefully inadequate. And with the vitamin D part of the picture, because we're talking about this, I'll see people that, because that range is so wide, 30 to 100 NGML for us in the US, even if people are on the lower end of that range, the 30, 31, or right on that border, they'll just say, oh yeah, it's normal, but it's not, right? There's more to it than that.
It's very similar what we have. Yeah, I think doctors won't even call below 50 nanomoles per liter deficient, which is I think is about 20, which is crazy. Like the literature shows that your body's going to be bleeding minerals when you're at this level. So it sounds like it's a similar approach that across the board that you get this medication recommendation, and there's just very poor management of the vitamin D levels, which is really important, because, and especially into old age as well. Like this is something that you can have really good control over, and you have remarkably good health outcomes from controlling that. Yet we're just not told to. It's just crazy, that we're being taken straight to medications.
While we're on the topic of vitamin D and vitamin D deficiency, what is the link between vitamin D deficiency and sleep apnea? And how can this affect our bone health?
Yeah, so one of the things we want to be looking at through is why the vitamin D is low, and obviously diet and supplementation come into that, but there are other risk factors. So, for instance, when we're talking about skeletal deficiencies, so when we're talking about crooked teeth, we often see breathing problems, and one of the big risks, because we follow Alzheimer's dementia a fair bit, for Alzheimer's dementia is also sleep apnea. So that's the lack of oxygen to the brain during sleep. And so this is a very common problem. This is something that a lot of people are suffering with and don't get diagnosed until they have frank obstructive sleep apnea, which is just when you're pausing for more than, a certain amount of time through the evening and your brain is literally going into to necrosis due to lack of oxygen. So what people have is they actually have they have a graded amount, especially in women 50 to 70. You won't always get the snoring. You will in a lot of cases, like eventually snoring comes on and then you get the apneas. But a lot of women will experience what's called upper airway resistance before they experience these kind of frank snoring and sleep apnea. And upper airway resistance, which was found in Stanford in the 90s, and what they did was they showed that the women of slight build, slight neck and head build, and what happens is that when we don't develop a jaw that fully fits our 32 human teeth, we have a smaller airway. So what this does is it builds pressure in the airway, and this condition is called upper airway resistance syndrome. Presents quite similarly to sleep apnea, and actually, but it's more silent. And so what it presents with is teeth grinding and kind of, jaw issues, headaches, migraines, poor sleep, anxiety, depression, digestive issues, cold hands and feet, poor circulation, and just the feeling of being tired. And so what the literature shows with sleep apnea is that people with sleep apnea deplete the vitamin D because their brain is in constant oxygen deprivation. So your body has to use up vitamin D in order to kind of, keep going basically. But in the same drain will happen in upper airway resistance syndrome. So if you're grinding your teeth, you just don't feel like you're sleeping well, your mouth breathing at night, then it's likely that if you're taking a vitamin D supplement, you're using half of it or so via this poor breathing pattern at night. one of the simplest ways to remedy that is via mouth taping. Now, the only thing is not everyone can do that at night. Not everyone has an airway that can actually support mouth breathing at night. So if you suspect this is you, if you grind your teeth, if you think you mouth breathe at night, if you have jaw issues, or just don't sleep very well in general, cold hands and feet, digestive issues, then you can actually get a scan. What we do is do a 3D scan on the jaw to check the volume of the airway. And what this does is it helps us to sometimes build a splint, so you don't have to wear like a machine, like a CPAP machine, in order to support the airway. And what that does is it takes away the brain's fight or flight response during sleep. So you're not draining that vitamin D, because you want all that on your side. Because if we think about, there's actually a good link between poor sleep and dental diseases, like the lack of proper release of melatonin at night, which is the body's major antioxidant. And so getting the breathing system right is important. You can do other treatment, like things like tongue posture work, sealing the tongue to the roof of the mouth. It's quite difficult, takes a bit of time for an adult to be able to seal that to the roof of the mouth during sleep. You can do jaw widening, which is a bit of work as well. But at the kind of an orthopedic support for the jaw can be quite instrumental in stopping the drain of vitamin D at night, so that you're actually mineralizing. Remembering that it's a very energy intensive process for your skeletal system, bones, teeth to remineralize, and you need a lot of nutrients. So you want your sleep to be very high quality. We have to support the airway for that to happen.
Yeah, it's not surprising to me to hear you talk about when we have issues with our sleep, we have sleep apnea, and this vitamin D deficiency is taking place, that oral health suffers. You're going to have issues with your teeth too. When you've got poor sleep quality, that impairs bone formation. It disrupts bone remodeling. There are studies that show this, and it leads to reduced bone quality and structural integrity of that bone. So that's pretty well documented at this point too, from a bone perspective. So I'm glad that you're sharing this here. Now, can we talk about the role of sleep and good sleep and melatonin too?
If we think of that in sleep apnea, where we're draining vitamin D, so one of the key processes in the body for your body to mineralize is one, the proper release of melatonin. But we have to think about how we're getting that, because a lot of people are in such a dysfunctional sleep pattern that their bodies just do not release these neurohormones effectively, and you don't even know that that's the case. So we really want the body to be bathing in melatonin through the night and having the deep sleep cycles and then the REM sleep cycles coming up, so that the body can go through the process that it needs to. In order to do that, you have to have enough nutrients. You have to have your vitamin Ds, you have to have your vitamin A's and your support fat-soluble vitamins and such. But the B vitamins are really important. So one thing we found is that the vitamin D supplementation actually upregulates the need for certain Bs. B5 is a really important one to help get into levels of sleep. We had a neurophysiologist on the podcast telling us about the link that she found between the supplementation of D, and she just did D and B5. That was her thing. But so I found that, so you take the active form of that B5 and you supplement alongside as well, and you get much better sleep cycle because the body's actually using the B vitamin, and you need all the B vitamins, but B5 in particular is one that does seem to be missed as well. But so for melatonin to be released effectively, you need to be breathing right. So you want to really tune into good, slow nasal breathing. And so that's things like alternate nostril breathing before you sleep. Because if you're not breathing correctly, your body will be in distress. So there are pressure sensors all through your airway. And when you sleep, the one thing you have to do is breathe. And so when your brain is detecting pressure through those airways, like we talked about before, it will actually send a choking autonomic fight or flight signal to the brain. That's that kind of teeth grinding signal, and this is going to disrupt your melatonin release. So breathing is really important. Nutrients are really important. Light is really important as well. So for the release of melatonin, it's really important to expose yourself to morning light as soon as the sun rises. So that's that early morning light, which is the infrared light, actually signals your brain to release melatonin 12 hours down the track. It's really kind of quite remarkable how our brain listens to light. And so exposing yourself to morning light is a really good strategy to making sure you're releasing healthy melatonin at night. But then also as well is that blocking that off. So dark environments after 6 o'clock or whatever the sundown schedule is in your geography is, making sure that we don't have overexposure to blue lights at night because that will block melatonin as well. So there's a nutrient factor, there's a breathing factor, but there's also an environmental light factor that you can control. And if all of these things are controlled, your body's going to release melatonin much more effectively. And that's where we're going to get into those sleep zones where it's actually restorative, where your bones will, when it's got the right aspects, it's going to help them to remineralize.
What are some practical tips or daily habits for somebody who's wanting to maintain good oral health that they can incorporate starting today?
Obviously, your oral hygiene kind of regime is important. I mean, I don't recommend fluoride. One of the main reasons is for the effect on bones. So we know that fluoride, for instance, absorbs into the teeth. It also absorbs into your bones. It affects the calcification of other organs as well, the thyroid and so forth. So hydroxyapatite is a good toothpaste because that's a mineralizing agent. So that's the actual natural biological calcium that your body uses to remineralize teeth. You can use that as a toothpaste. Iodine is a really good disinfectant. One thing that I really recommend is actually nasal rinsing. So you brush your teeth daily, but you should also be washing your nose daily. So I do this a nasal rinse twice a day in order to keep the nose clear and to make sure that I can breathe through the nose, because we actually form the body's reservoir of nitric oxide from the nasal sinuses. And if you have a blocked nasal passage, then you're not going to release the molecule efficiently through breathing, and that's that kind of connection to sleep that we're talking about. But cleaning the nose is a regime that I think is really important, because if you breathe well, your oral environment's going to be so much better, because we see the propensity of mouth breathing as being one of the biggest issues with dental disease and their presentation. And so breathing is really important too. So one thing that I try to reinforce to my patients every day is tongue posture. So sealing the tongue to the roof of the mouth, learning to seal the tongue to the roof of the mouth is really important. So when you're not eating or speaking, your tongue should be sealed up to the roof of the mouth. This blocks the oral route of breathing, but also supports your posture, supports your head posture, and it creates a strengthened oropharyngeal system here, that when you sleep, if you can learn to seal the tongue to the roof of the mouth, you're going to calm this whole area in the brain down, because through the parasympathetic autonomic nervous endings that tell the brain to calm down. The other thing that does is strengthening your tongue actually activates the vagus nerve, because one muscle at the back of the throat, so they're all innervated by the hypoglossal nerve, which actually hypoglossal toning is one treatment for sleep apnea. But if you look at the anatomy of the tongue, the back of the tongue is actually innervated by one of the muscles called the the vagus nerve. And what it does is it lifts the back of the tongue up and it tones the vagus nerve. So it starts off vagal tone. And this is a really important cranial nerve that turns on all of the different organs in your body. So vagal tone's one advantage of improving your tongue posture, strengthening your tongue by sealing it to the roof of the mouth.
And do you like tongue scraping?
Yeah, tongue scraping is good. Yeah, so you get a plaque build up on the dorsal surface of the tongue, so you can get right to the back there and just kind of scrape. With usually a copper tongue scraper is a good tool. That's a good tool to kind of, sometimes people with breath issues or a bit of a build up can help control that plaque retention area.
Can we talk about for a second your thoughts on root canals, cavitations? How would you approach addressing those if somebody's listening to them listening to this right now and they're considering a root canal, do you have any suggestions for them or important considerations?
Yeah, so for people that have root canals or have one or have been suggested they need one, root canals are a bit of a gray area for me. I'm not completely against them. You want to consider your susceptibility. So what a root canal is where we're actually mummifying the tooth into your jawbone. So the nerve is dead and we're disinfecting and putting like a filling inside. A lot of people are okay with root canals, then a lot of people aren't. The risks that I see for people that maybe aren't suitable for root canals are any kind of autoimmune issues, any kind of chronic fatigue, any kind of thyroid issues. Chronic inflammatory issues may increase the susceptibility to chronic infection. So you can get chronic infections with these root canal systems. So you want to assess whether it's for you. People that don't really kind of vibe with root canals, that's usually an indication that they're not for you. However, the flip side is losing your tooth, unless you have a replacement there, decreases the amount of bone density in your jaw, which decreases the amount of airway support. So there is there's an argument to keep every tooth in your head as we age because it supports your airway, and everything we've talked about is keeping this airway patent through the night so your body can calm down, mineralize your skeletal system and use the nutrients that you're giving it. So there's an argument, that if we have an affected tooth, do we replace it with a ceramic implant, or do we plan for some kind of restorative there to maintain the bone density, because the bone length and each tooth holds airway. Once it all collapses a bit, you kind of see the people that have dentures when they're old, you see the face collapse. That is also affecting their airway as well. So root canals are a gray area. I wouldn't completely rule it out. If you're a healthy person, I wouldn't completely rule it out. If you keep your tooth for 5 years, that's not a bad thing. If you have any other susceptibilities, I'd say it may not be for you. You can take it out and maybe think about a replacement with a ceramic implant. Yeah, and if you've had an extraction and you're worried about anything like a cavitation, a CBCT cone beam scan can check that. It seems to be more common in America. We don't see them so much for some reason. Might be mold related, but I would be thinking if your bone isn't healing, we need to be thinking of that vitamin D system anyway. We want to make sure that that's optimal so that your bone can heal.
Hey, it's Bone Coach Kevin Ellis. Thanks so much for tuning into this episode of the Bone Coach Show. If you're finding it helpful, please leave a positive rating and review. Hit that like button, subscribe to the podcast or the channel. That lets us help more people and reach and serve more people. And it also lets us know that this is helpful to you on your journey to better health and stronger bones. And then also, right down in the show notes, you can actually find a link to my free Bone Healthy Recipes Guide. That's going to give you access to some amazing and delicious recipes to support your journey to stronger bones. And then also, we have a link to my free Stronger Bones Masterclass in the show notes too. And that is the 3-step process that has helped people in over 1,500 cities around the world get confident in their plan for stronger bones. Over 110,000 people have taken part in this, and it's been really, really helpful for them. And I want you to have free access to it too. So add your name and email right down there in the show notes, get access to that free Stronger Bones Masterclass, and let's get you confident in your Stronger Bones plan today. And a lot of our listeners are not just concerned about their oral health, they're also thinking about their kids or their grandkids, or maybe they have a son or a daughter that they want to share some knowledge or wisdom with and maybe make some helpful suggestions. What would you say to that person who's the parent or the grandparent trying to set their kids up for great oral health?
Yeah, this is a big area because like during the early development stages, there's so much going on where the jaw is developing, and all the dietary principles we talked about are quite critical. Then, so kids that eat high sugar, high cereal, high, these diets that are lacking fat-soluble vitamins, we're seeing that just the jaw development is just not happening in them because they don't have those nutrients. So kids need to eat nutrient dense. They need to eat a lot of meat. They need to eat a lot of organs. They need to eat a lot of eggs, dairy if they tolerate it. And that's the kind of basis for their skeletal growth. Because you think about all this, the skeletal system is forming in those early years, and the food they get is fortifying their bones. And so you really want to be reinforcing this during the development years, even right from 6 months. I've got twins about to turn a year old, and the first foods, we don't give them any kind of sugar, we don't give them any kind of even fruit earlier in life because of the fructose and the sugar. We give them kind of nutrient dense kind of meat purees from the get-go, and then they start to chew as they get teeth and so forth. But those early kind of food experiences they have, creates the foundations for the skeletal system they have down the track. Sleep issues are really important. Don't let kids breathe through the mouth. Kids shouldn't snore. Any kid with an airway issue, like you've got swollen adenoids and tonsils or things like that, they should be checked out. You don't want to let these things go because it affects their development. So we can do intervention orthodontics now. So we start from 3 to 5. We start expanding the jaw really early, and we also intervene between 7 to 12 to try to get the jaw to grow so that the teeth fit instead of waiting for braces when they're 12 to 13. And the advantage of that is you actually fix the airway system. So you fix their breathing so that they correct, the body puts the teeth where it wants to go rather than us dragging teeth around and missing the underlying breathing and jaw issues that occur as a result. So watch that in these developing ages is really important. Yeah, and just good food and breathing, and so that create the foundations for healthy teeth and jaws lifelong.
I love that you talked about how important that development is from such a young age, because 90% of your skeleton it's being put on by the time you turn 18. The remaining 10% fills in by the time you turn 30. I always tell people the decisions you're making or helping your kids and grandkids make from a young age, it could add 10, 20, 30 years of good quality to the end of their life. You help them make better decisions, now from a young age. So
totally, such an important message. It's and when we see this jaw development picture, the bone quality I'm seeing in kids these days, like because you take a wisdom tooth out of a kid compared to, say, someone that grew up in the country 30, 40 years ago, like it's not there. Like, so we're worried about, if we're seeing a rise in osteoporosis now, imagine what it's going to look like in these kids that are not developing well. Like it's quite alarming. Yeah. So we really need to kind of turn the corner, and that's a really important message.
Yeah, totally agree with you. Anything else you want to share? I want to make sure we let people know where they can find you. So maybe let's start with that, and then we'll close out with any important message you want to share. This has been a fascinating conversation, and I've really appreciated this. So maybe we could share where people can find you and touch on the book that you've got as well.
Yeah, so my website is drstevenlin, drstevenlin.com, and they can jump on there and listen to my podcast, The Mouth Brain Connection. I've got a book, The Dental Diet, which kind of explains and gives a meal plan for all of the things we discussed, but it goes into the science of the dental issues that pop up because of our food system. They can find me on socials at Dr. Stephen Lin, Instagram and Facebook, where we share oral systemic information. And just kind of jump on and follow the podcast and the book if they're interested. And they can find most things on the website.
I love it. Well, yeah, and if we'll link to your Instagram and social there as well, and that way everybody can find you on your websites, your social. That'll all be in the show notes. And any last message you want to leave our audience with before we hop off here?
Yeah, I mean, like, you're in control of your health. If you have a diagnosis from a doctor, or you don't feel hopeless, or like don't feel that there's one avenue, I find that there's a lot of different kind of pathways out there now to kind of really take control of your health. And you doing that can be, it can be, we've seen, lives change quite significantly by taking control of their own parameters for health and really kind of feeling, that you have control of your life. So I would say if you have a diagnosis, or something like that from your doctor, that there are avenues out there to help you.
What a powerful message. Thank you so much, Dr. Stephen Lin, for taking the time to share your knowledge and expertise with us. For everybody listening, you can find all the resources, show notes, everything mentioned here today over at BoneCoach.com. We'll see you in the next episode. Hey, it's BoneCoach Kevin Ellis. Hope you found that episode helpful and that you enjoyed it. Just one last reminder, if you haven't done so already, head over to BoneCoach.com, sign up for your free 7-day osteoporosis kickstart. It's going to tell you everything you need to do to start getting on the path to improvement. Hope you found this helpful. I'm your Bone Coach, Kevin Ellis. I'll see you soon.